When I heard the topic from Pal sir, stop doing PCNL and RIRS is the way for managing renal stones, I thought, is this a joke? Then I saw these two jokers. Oh, then I realized what is happening. I'm warning you guys. Both of them are like, one has a business interest in conferences and workshop. Other fellow is known to give you impure advices, always. So, what he will lure you with different models, different, gadgets available to you. He's going to trap you with all this, modern, outward sexy appearance, talk, but you don't fall for these high maintenance gadgets, okay? Just be sensible, believe in yourself, you are a surgeon, go for PCNL, because what Pal sir has said just 1 hour before that, what you need is a perfect puncture to get into a pelvic LSL system. That is the shortest route you go for the stone. If I have to end the debate, this is the slide. Managing upper tract calculi, if the size of the stone is less than 10 millimeter, RIRS is not better than ESWL. If the size is more than 10 millimeter, RIRS is not as good as mini PCNL. That's it. But let me give you some scientific backup. There is enough study, I just one study quote that RIRS versus ESWL, which has been published and shown that the ESWL is equally good and it is always preferred by the patient. RIRS is always preferred by a surgeon. Why RIRS all the hype and not worth the flamboyance? This is the review article again published recently. You look at, do I have a laser pointer here? You see this three, series which is compared. You see all these stones are 11 millimeters, average size, but time taken is 80 minutes and more. And what is the stone free rate? There's no laser pointer, but this one? No, it is in the white, it is not. So the first and the third series which shows maximum stone free rate is less than 90%. And the middle one is showing the stone free rate of 74% because it was a prospective study. And all high stone free rates are retrospective study, and you know what retrospective studies are biased, how they are biased. Let me talk about RIRS complication. Kandar, your master's voice himself has said that in his review article that these all things can happen with the RIRS because the stent-related discomfort is as high as 88%, ureteric wall injury can as high as 70%, residual fragment rates is as high as 59%, difficult stone access, you plan to do RIRS and you are unable to do the RIRS or access the stone itself, rate is as high as more than 30%. Rest I am just ignoring. So all these complications are there in the RIRS, so beware that RIRS is not a cakewalk. Again, अंदर की बात बताऊं, if you use, this is our fellow is talking last week only, Kandarp, in the West Zone conference. If you use excess sheath, there is a high chance of ureteric wall injury. And whatever is flashing on the screen, he says that these are all my ureteric wall injuries. And if you avoid using excess sheath, the intrarenal pressure goes up. So you are in problem both ways. हम लोगों को क्या मौसी जी समझाए क्या शोले का RIRS में लाख प्रॉब्लम है तो भी मेरा RIRS सबसे अच्छा है. Now Chandramohan is saying that I am using a thulium fiber laser, high power. Olivier himself is, and this gentleman from their own Western preferred literature is saying that high power holmium or thulium when you use, it has to be with a suction and a 14 French ureteric access sheath. Then only it offers a good clearance. Again, his own Guruji is publishing this article, it is in the pipeline, which says that the ablation rate with the thulium and operative time is slow, but the fear of thermal injury is very high. So don't fall for all these commercial gadgets or advertisements or a preference by a industry. He has said that this can be dangerous in inexperienced hands. So RIRS is also equally dangerous. Really, nobody wants to talk about is this. This is the data. If you do a CT scan after the ureteroscopy or RIRS, the maximum clearance you got is 80% in a ureteric stone, then a solitary pelvic stone, and then after the pathetic clearance rates, they have been reported. Even as, all these rates are high when the stone size is crossing more than 10 millimeter. Another study which clearly shows that RIRS residual mini PCNL is far, far better. Yes, ultra mini PCNL or micro PCNL, where you again follow the principle of dusting and powdering and leaving the fragments behind, then it is equivalent to RIRS. But ultra mini mini PCNL, any sheath more than 15 or up to 20 French sheath, stone-free rate is definitely as high as 95 to 100%. I am quoting my own patient, my friend's wife. I did RIRS nicely in 24 to 48 hours. She went home, and this was the clearance center X-ray. But after about a year, she started developing a stone again in the upper calyx. And in 2020, she had formed full-fledged multiple renal calculi. So all these residual fragments should be taken seriously. I had to do a mini PCNL to offer a clearance. These are the things which we don't even talk, that patient have to come back for unplanned. And all this, my friends are following the Western literature and saying that the URS has become popular, and they are thirsting upon you that RIRS is better. Cost of RIRS is less. This is what the Western literature says. But what about the Indian literature? This is a paper published by a Nadiad group, I think presented in the World Congress in Germany. They have compared head-to-head with thulium laser, RIRS versus mini PCL. What did they find? Recently, last month, mini PCNL, less lasing time, less energy use, less operative time, faster stone fragmentation, everything favorable to mini PCNL. RIRS, only less hospital stay, and comparable is complication rate and stone-free rate. So they will, frighten you. You have come here to learn PCNL, not get frightened by some pictures shown by somebody. Another paper recently published by Janak Desai in the Urolithiasis journal is that the UMP is also safe and effective and more economical to RIRS, because this is done in an Indian setting. So we know the cost of treatment overall RIRS is definitely higher. Another interesting paper which I came to know is this. This is an Italian study where they say that the outcome, when outcome is equivalent between mini PCNL and RIRS, why you want to thirst upon something costly, as well as it gives a psychological problems to a patient, because hospital anxiety and depression rates were found to be higher significantly in patients with RIRS because of the residual fragments and repeated hospital admissions. Cost, you all know, this is not rocket science. Another system, this is the last slide, which I would like you to listen.
Ye hai NASA's most ambitious project ever, Juno, the spacecraft on a 5-year mission to discover Jupiter's secrets. Juno's scientific payload includes a color camera that will give the world the first ultra-wavelength microwave radiometer. In addition, it also has specially designed no cameras please ultra-high-speed engines that will take it to Jupiter in just 1 year. Any questions?
Yes. कितना देती है?
For a country that is obsessed with cost and outcome, make the right choice. Choose PCNL.
So I would like to conclude here is the conventional or a minimally invasive PCNL are here to stay. It is not going anywhere, and PERCONs are also here to stay, Pal sir. And for Indian urologist, it is very important to know to do a good PCNL. Thank you.